Hi, I'm Dr. Julieta Peralta Arambulo, a diplomate of American Board of Hair Restoration Surgery and Fellow of International Society of Hair Restoration Surgery. The success of the procedure is also dependent on how well you follow the post-operative care. For optimal result, it is important to keep the graft safe and well protected. Before you leave the office, my staff will again review the post-operative instructions, the medications, and the supplies you will need to take care of the transplanted grafts. This bottle contains saline solution. It will be used to spray saline water onto the grafts every hour and is done best on the first 24 hours after the procedure. Following this instruction, it's important to decrease the scabs formation. If you experience some itching, either in the transplanted or sutured area, spray the saline water or simply tap the itchy part to provide relief. Do not scratch using the fingertips. Do not remove the microfoam tape. Keep it on the forehead for 3 days. This is done to decrease or avoid swelling of the forehead and around the eyes. A surgical scrub sponge will be given to you for the post-operative cleaning. This video will teach you how to use it. Before you leave the office, clean baseball cap or loose-fitting hat or big handkerchief or scarf or bonnets that you brought will be used to cover the transplanted grafts. By this time, the staff has informed you already of your scheduled appointments, which are indicated on the first page of the post-operative written instruction. The first cleaning of the scalp, which is the following day, and the different dates of removal of 2 kinds of sutures. Avoid direct trauma to the head for 2 weeks after the procedure. Be careful when you go in and out of the car to make sure you don't bump your head. Take a taxi or have someone drive you. After the procedure, it is important that you go straight home. Remove the hat carefully and review the medications. Take the pain medications before the anesthesia wears off and review the post-operative take-home medications. Do not take medicines in an empty stomach. Do not drive or take alcohol while taking pain reliever sleep aid medication. You must sleep with head elevated at 30 to 45 degrees the first 4 to 5 nights after the procedure. This will be accomplished with 2 to 4 pillows under the head, or simply sleep in a recliner chair. It is normal for the stitches to ooze while lying on them. You can place a clean towel to protect your pillows. You can turn on your side but do not lie flat. And be careful that the transplanted grafts do not touch the pillow. A neck pillow can be used if available. This will help prevent grafts from touching the pillow and help reduce swelling. The following day, you will return to the center. Our staff will show you how to clean the back sutures and the grafts. During this time, little amount of tap water is used to clean the transplanted areas. This is done gently so that the grafts will not be dislodged. And using the fingertips or the scrub sponge provided, clean gently the back sutured area. Following these will help decrease graft formation and therefore scar formation. You can use the saline spray provided. Spray the saline every hour onto the transplanted areas for 24 hours to decrease the graft formation. We want the grafts to adhere solidly during this time. Apply thinly the antibiotic ointment along the sutured area 2 times a day until sutures are removed on the next scheduled appointment. You will shampoo your hair for the first time. Fill with water the plastic bowl. Place enough amount of shampoo and shake. Gently pour the mixture on transplanted areas. To clean, use the surgical sponge and gently blot up and down onto transplanted areas. Be careful and gentle so that you don't dislodge the grafts. Use also the sponge or fingertips to clean the back. Please be careful with the knots located at each end of the incision. Gently pour the water from the pitcher or bowl to rinse. Lightly towel to dry the sutured area. Do not rub the towel against the grafts. Gently pat dry with a towel and leave it off. Allow the hair to dry by itself. Each time you shampoo your hair, rub the sutured area gently with your fingertips to prevent crust buildup. Apply the antibiotic ointment to the stitches to avoid infection. The best way to do this is to lift the hair with one hand and apply the ointment along the stitches with the finger of the other hand. You will need to do this 2 times a day. Apply the ointment thinly and wash every day until the sutures are removed. Following this instruction may result in less scarring. Do not apply alcohol or hydrogen peroxide. Mix enough amount of shampoo in a pitcher with water, cover with a lid, and gently pour the mixed shampoo on transplanted areas. Use the surgical sponge and gently blot it up and down to transplanted areas. Gently pour the water from the pitcher to rinse. Pat with the towel to dry. Do not rub the towel on the grafted area. Pat dry with the towel and leave it off. Allow the hair to dry by itself. Resume shampooing with a gentle stream of water from the shower. You may block the stream of water with your hand so that the pressure of the water is not too strong. Wet the area for at least 10 minutes to soften the crusts. Apply shampoo directly on grafted and back areas. And to produce a lather, move the bulb of the fingers in a circular motion. Then rinse off using the shower. You can shampoo your hair twice a day to soften the crust further. Pat gently with a towel to dry. Do not wrap the towel on the grafted area. Simply pat dry with the towel and leave it off. Allow the hair to dry by itself, or you can use a hair dryer this time, but only at cool setting. The scalps will start to fall off. This will occur for a 2-week period. The scalp usually turns pink due to the inflammation and increased blood flow to the traumatized area. It can last 1 to 3 months in some patients and gradually disappears. After 10 days, you should be able to shampoo normally. However, scratching with nails should be avoided. The grafts are now set in place. The only way to dislodge the grafts is by forcefully picking at them. The scabs should be loosened or falling off already. If the scabs are still persistent, continue the flow of water from the shower for more than 10 minutes in every shower. Shampoo moving the bulb of the fingers in circular motion. And to further soften the scabs, use of frequent saline spray will help. The schedule of suture removal are written to the first page of the postoperative instruction. Continue to clean the area and apply the antibiotic ointment. This is done to avoid infection. If absorbable suture is used, it may take up to 3 to 4 weeks for the absorbable stitches to be dissolved. In hair transplantation, we recommend this treatment 3 days after surgery and 2 times a week thereafter. Please inform our staff if you want to avail of this program. On occasion, swelling may occur. It is not dangerous and is painless. Swelling usually occurs around the 2nd to the 5th postoperative day and again should not be a cause for concern. It resolves after a few days and does not require any special treatment. Keep microphone tape across the forehead for 3 days, beginning immediately after surgery. This should be kept for 3 days after surgery to avoid swelling of the forehead and around the eyes. Do not bend over to pick up things for the first 5 days to prevent swelling. Sitting up and sleeping with head elevated is preventive. Lie supine with head elevated by 2 to 4 pillows or rolled over towel or neck pillow to place under your neck during sleep for the first 4 to 5 days. The first 4 days, take it very easy. By the 5th day, you can start activity such as treadmill, lightweight lifting. Avoid strenuous activities. Too much physical exertion will build pressure in your head. Following this precaution will help prevent the grafts from being dislodged. Do not engage in contact sports until your sutures are removed. However, after 2 weeks, you may resume your normal activities, but still be careful not to stretch the donor area. Avoid sun exposure for 1 month. Wear a hat or cap for protection, especially when going out. And if available, use a strong scalp sunscreen. You can swim in a pool after 7 days or ocean and lake after 14 days. The success of the procedure we have just performed is determined by the abilities of the physician and the surgical team, but it is also determined by the degree to which our patients follow the post-operative instructions. If you have any questions regarding these instructions, please contact the office and our nurse will be happy to explain the process in greater detail. Thank you for your cooperation and patience in following these instructions.